let me start recording first. And you can read out. I have to do something on my side. You can just read out there, okay? Meanwhile, I have to start your class here. Oh my goodness,
Okay.
there's no planner here. Oh my goodness, I have to add the planners, otherwise I will not be able to start class, to end the class of Abdul as well. Meanwhile, I have to start your class. Abdullah is here. Okay, so just what do you think? Agnes Semmelweis was a doctor in Vienna in 1846. It was his job to oversee the treatment of women during childbirth in two maternity clinics at the Vienna General Hospital. It was very common in those days for women to die shortly after childbirth from a condition known as, yeah, which one? Hmm? What is this? Pure, pure purple.
Puerperal fever.
Yeah, purple fever, which we now know to have frequently been caused by infection with a pathogenic bacteria, Streptococcus pyogenes. How do pathogenic bacteria negatively affect the body after the first infection? Yes, Abdullah.
Okay.
Hmm?
So after the first infection, the white blood cell and the antibodies are not ready for it. So um,
Hmm.
mm,
Okay.
so it affects like mm,
Mm-hmm.
it causes the cells to like wait no.
Mm-hmm. Yes, yes, you can
So
answer
it
like that.
I
Good.
think so it releases like toxins and so that's why
It's okay, fine.
yeah.
Like, all right. I mean,
So that's
wait,
why
wait.
it causes
Hmm. Some damage, definitely some damage to the body cells or tissues. Is this what we can say?
mm,
Pathogenic bacteria are doing
yes, yes.
what? What they need, what they have to release by while causing any of the diseases.
Okay.
And you definitely some
They
toxin,
release toxins. Yeah.
right?
Yes, yes,
So if the
yes.
pathogenic bacteria release toxins, so how they will definitely that damage body cells and tissues, right?
Yes.
Okay.
So that's why, yeah, so that's why the
This is,
woman can die shortly after the childbirth.
and this is one way to answer.
Okay, so what's the other one?
We can also go from, for example, pathogen, in the sense like a protein, a glycoprotein on the surface of pathogen that triggers an immune response in that sense. We can talk about that in on infection. Okay, fine. So I mean, definitely this is one thing because it's only one mark question, so we can't go on the other side. So you just need to release toxins and which actually damage the body tissue, I would say, or you can also say like to damage the body cells or the body tissues, right?
Yes. So I've written the answer. Can you see it?
Yeah. Okay. You would say pathogenic bacteria release toxins that damages or toxins that damage the tissues and cells of in the body, right?
Yeah.
This
Mm-hmm.
is what you need to answer.
Mm.
Okay, great.
Yes.
The next question is you have a table here.
Okay.
I'm going to have a table. It's of again hard question. I'm going to paste the table 1 for you, Abdullah. And table itself is here. Wait a second. Then I'll see like how we can work on this. It's a 2-mark question. You need to answer it as per challenge. Okay. Look at this. It's for you.
Okay.
Calculate the percentage death rate in the first clinic during the year 1843. Hmm. How you would tackle this
Okay.
question?
So what? Wait. Let me just calculate the answer. Wait.
Yes, definitely
Mm,
you should look into the diagram in this table first. You have time, no worries. Take your time, okay? No need to be hurry and
mm.
to give the wrong answer. Try to think about it. Brainstorming is quite important, okay? Try to link your question, read it 2 3 times, then after you can go for. It's a great 1843. So do you have 1843 here in the table?
Yes, yes. So do we have to tell the exact value?
Hmm.
Okay, okay, okay.
1843 is here. Number of births, number of deaths, death
Mm-hmm.
rate. Death rate is absent. You need to find out the death rate here, okay? It is not given. Number of births, number of deaths, death rate is here. So this is what you need to answer. Death rate is actually, I would say, deaths divided by birth. And you need to multiply it with 100
100.
because it's a percentage.
Mm-hmm. Yeah.
So what's the ratio of death? What's a number for death and how how many?
Mm-hmm. Okay, okay. So number of that is 274. So we're gonna do 274
Hmm,
divided by 3060.
okay,
3006.
yeah, and you
And
need to
then we're gonna
multiply it
multiply
with
it by 100, which is going
mm,
100. So it's gonna be
mm-hmm,
8.9.
8.9. So round off this like how you can do it.
9.
Hmm.
It's wait, let me write. It's gonna be
Good.
okay. I've written the percentage.
Hmm. Next one is the next question related to this topic is
Mm.
no, that's a new question. Question is here. This one.
Okay. Mm.
And I'm going to have this one graph for you to so that you may understand how to answer it. This is the question, actual question. Here it is, like this.
Mm-hmm. Okay.
So, describe how introducing a hand washing policy affected the death rate from purple fever.
Okay. So when the hand washing policy was first introduced, um, it kills the bacteria in the hands of the doctors.
Just
And
write down the proper
okay,
answer. Yeah,
okay,
write down the answer. Then after we'll discuss.
okay.
Question is, describe how introducing hand washing policy affected the death rate from the purple fever.
Yes. So firstly, I will obviously the death rate decreases. But it's not a 1 mark question, it's a 3 mark. So I'm explaining everything.
Hmm. It's a 3 mark question.
Yeah.
Good. Yeah. Washing hands kill the bacteria in the nurse's hands. By doing this, the bacteria will not spread. As a result, death rate decreased after the hand washing. Hmm. Okay.
So I've written the answer. Is it correct?
Because it is how based questions, so we don't need to go for something like to give the reasons. Washing hands kill the bacteria in the nurse's hands. By doing this, the bacteria will not spread. As a result, death rate decreased after the hand washing policy, after the strict enforcement of the hand washing policy. Okay. Is there any like uh at the very start, if we see, you know, the first thing that you need to mention here, like after the hand washing policy was first introduced in 1847, you need to talk about bit, you know, from by just explaining this graph. Uh, 18 introduced in 1847, right? Death rate fell but still fluctuated. Is there any fluctuation there in the graph?
Yes. Yes. Yes.
So you need to mention that first. It is the death rate fell but still fluctuated. In the second point, as per Mark's scheme, you would say when hand washing was strictly enforced in 1848, the death rate dropped sharply. Okay,
Mm, okay.
this is your second point because we have to fight for 3 marks. Right now,
Mm,
you have done for two. Still, 1 mark is remaining. So the death rate remained consistently low. That's close to about 0 to 2% that you can see in the graph. Okay,
mm,
afterwards, showing that strict enforcement greatly reduced purple fever deaths. Getting? So this is your third point that you need to add here. All right, Abdullah?
okay.
Yes, Tokia,
Mm,
you need to write something.
now I'm writing.
Yeah, 3 points. First, you have to start with 1847. What is the situation there? Like it was introduced, hand washing was introduced at that time. Death rate fell but still fluctuated. When hand washing was strictly enforced in 1848, the death rate dropped sharply. Okay?
Yes. Okay.
Yeah, great. Try to answer this properly. Then after we'll go
Mm.
for the next question.
I've done the answer.
Then,
Yes.
hmm, why it's be like that? Okay, washing hands kill bacteria. What is that? Hmm. Okay. After the hand washing policy, but still fluctuate. What after the hand washing policy? What is this?
Death rate decreased after
Wi-
the hand
You
washing.
should start with like 1840 what? Where is that? You need to write the answer like first introduced in 1847, and you need to talk about then 1948. It is started in 1847. You can see like the number is getting decreased, but still fluctuated. So you need to mention like this after the hand washing policy
Okay, okay. So in
introducing,
in 1814.
because this take uh, information from the graph.
Yeah, okay. In 1847,
Yeah.
it was firstly introduced.
Hmm.
18,
But death rate still fluctuates. Okay, just write first, then after you can rephrase. It's okay, fine. You can just complete this first, and then you can check how you can rephrase it. Good. Yeah, now it's fine. In 1847, hand washing policy was first introduced, but death rates still fluctuate. In 1848, the hand washing policy was strictly enforced. After that, death rate dropped sharply. Hmm. Okay, that's fine. Now it's somehow is making some sense, right? That's but
Mm.
please this should not be different from the first one. Like I mean, we have to work for accumulatively. We have to work for 3 marks. So this is for I think 2 marks are here. Still, we need to have 1 point. And what's that? Let me pinpoint that point. Okay. The last thing is the death rate remained consistently low afterward, showing that strict enforcement greatly reduced the perpetual fever deaths. Yeah, it's fine. Last point. There's no need to have this like the first one. This should be at the end of it. Like you can washing hands kills the bacteria that nurses hands. By doing this, the bacteria will spread. As a result, death rate. No, I don't think so. This the first part should be removed from here. You can just
No, no.
add. Hmm.
I didn't remove the first part, so when I will review it, I will know this answer of mine was not correct. Because so firstly I wrote it in black and then I wrote it in blue. So I will know what was my correction and what I did right and
Oh, okay, okay, all right. So this is that you have changed the color. Okay, fine. But you have to, what you need to do is to rephrase this part somewhere, like because the third point should be also like some that should be clear. In force after the death rate dropped sharply. washing was strictly enforced. Hand washing policy was strictly enforced. After that, death rate dropped sharply. Hmm. Hmm. And it remained consistently low afterwards.
Okay, and
You can see here, like the hand washing policy is strictly enforced. Then from here in this graph, you can see like this one. You can see here like this is getting down, 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 and down, down. It's still down, okay? Still down from here.
yes, I've written the third one too.
Yeah, this one. You can see here.
Yeah.
It should be consistently low after that. After that or after the implementation of the
Hmm.
policy. That's fine. Now we can
Hmm.
move for the next question. At the times of Semmelweis research, bacteria had not yet been discovered. Okay, so here what we can do right now is to have this question.
Okay.
This one. Oh, sorry. Where it's going? What's I'm doing? Okay, Abdullah, look at this. Here's a question. At the time of Semmelweis research, bacteria had not yet been discovered. Abdullah, give
Yes,
our
yes,
modern day knowledge of pathogens and their methods of spread suggest two other strategies doctors should carry out in order to avoid infecting their patients.
So it's linked to the last part.
Yes, definitely.
Okay.
It's a last part in what sense?
The last question, and the one we just did. Okay.
As per figure, uh definitely it's not separate, but yes, let me check.
Okay. Uh, so I'm writing the answer.
Hmm, it's the previous one was C, it's D. Hmm. Yeah, are you in the answer?
Yes, yes, yes.
Good. Which strategies everyone can use?
Hmm?
Yes, using clean equipment. Okay, fine. Give our modern day knowledge of pathogens and their methods of spread. Suggest two other strategies. One strategy is what? Mm,
Using clean equipment and
doctor
uh,
should carry out in
using
order to
okay, okay. Using gloves when
gloves,
in no when they are in contact with the patient.
protective clothings. Yeah, gloves and mask. Hmm.
Yeah.
Sterilizing surgical equipment before use, wearing protective clothing such as gloves and mask. Okay,
Okay, okay.
got it.
Yes.
So these two strategies that one can adapt. Hmm. Then after we can go to have a question. In order to feed growing human population, knowledge and methods separate, give, describe, introducing. Where is that? Suggest two strategies doctors should carry in order to avoid the infection. Okay. Then after we can go to have a questions.
Mm.
In order to feed growing human population, farming practice has changed in recent years to be much more intensive. Animals are often kept in small barrens with hundreds of other animals in close proximity. This has led to the rise in the number of farm animals suffering from diseases caused by pathogens. Explain why.
Mm. Okay.
To prevent the
Mhm.
spread of these pathogens, some farmers give antibiotics to their livestock even when they are not sick. This has increased antibiotic resistance in animal pathogens. Explain how this has occurred.
So, okay. So, first question, I'm writing the answer. Okay.
As per according to the mark scheme.
Mhm.
Yeah, good, good. Yeah, keep on writing. Okay, great.
Mm.
To prevent, keeping animals in close proximity will spread pathogens more fastly. Question is explain why. Because of unhygienic conditions or something like that. I don't know. You need to answer, then after I'll help.
Mm. Okay.
Yes, good. Most small burns can cause mm, less space close to. Good, good, good. Keep it up.
Mm. Yeah, that's it.
That okay. You know, once animals are kept close together, so as you know, the pathogens spread more easily between them. As you said already, that that's quite easy. Stress and poor conditions definitely that weaken the immune system, right? Because they are living in such a place. So making them more susceptible to disease,
So, we can say poor conditions.
weaken their immune systems,
Poor conditions. We can.
and making them more susceptible to disease. Okay.
Making them what?
More susceptible, are
What the,
more prone to disease.
okay.
All right? Yeah. Are you getting?
Yes, yes.
Great. So, overuse of antibiotics kills non-resistant bacteria, but resistant bacteria survive.
So in the part B,
Yes, in part B, just write
which
the answer.
okay.
Mm-hmm. Yeah, please. Just write the answer, then I'll see. Giving antibiotics to animals even when they are not sick can cause. Giving antibiotics to animals even when they are not sick can cause resistance because there is no bacterial infection in the animal. Yes, Abdullah?
Yes. Oh.
Done.
Mm,
Antibiotics course has to be complete in order to avoid resistance.
I know this is not a complete answer, but I have no other point.
It's a 4 mark question, right? 4 mark question. You need to add at least 4 points. That's one is fine, like overuse of antibiotics kills non-resistant bacteria, but resistant bacteria survive. This is one thing. Like antibiotic, if you use the antibiotics,
Oh
so
yeah, yeah, yeah.
those bacteria will
Yes.
die which are non-resistant. However, resistant bacteria will survive. This is one thing. And once the resistant bacteria reproduce and pass on their resistant genes to the next generation,
Mm. So there will
okay?
be, sir, there will be no like it will be hard to treat the animals with the
Yes,
like with
because
the antibiotic.
the next generation is also already uh, resistant to that specific drug. or that specific medicine. Okay. So this is second point. All right. What would be the third point
Mm-hmm.
here? With a with the passage of time, the population of pathogens become more resistant. Okay.
Okay, okay. I'm writing this.
So the
So
la-
causing the next
so the last
bacteria to
point that you
get
can add here,
resistant.
antibiotics then become less effective at treating infections. Getting?
Yes. Antibiotic.
Okay. You are in a mood to sing a song on today. All right. Are you interested in it?
No, no.
You're not interested in singing? I mean, what's your hobby other than this? Like from studies, what you really like, what you really love to do? Any
Play sports.
sports?
Yeah, sports.
Sports in what type of sports? Like any game, anything that's specific?
Cricket.
Cricket. Oh yeah. Are you a batsman or bowler?
I'm a batsman and a spin bowler.
Okay, you're a batsman and spin bowler. That's good. Who is your favorite one? Favorite player in all over the world or in Pakistan? I would say
Pakistan's Babar Azam.
in all over the world, like in
Hmm. I
any.
think Virat Kohli. Virat Kohli.
Ah, yeah, he's good. Okay, that's good. So it means like you have some knowledge of cricket.
Not some. I have too much.
Oh, really? It means like
Yeah, yeah.
so it means like you wanna go to take it as a profession, as a professional cricketer.
Yeah,
Definitely.
but
Hmm.
yeah, but now I'm too old. So like
Mm-hmm.
I'm 15 now, so it's too late. So that's why.
Mm. So they always take in even less than 15, like uh
No,
to
I
under
said
20.
so. It's like my age is like 15, so it will be hard for me to get into cricket now. So,
Mm-hmm.
mhm.
But you can take it as a hobby, as I would say,
Yes,
like
yes.
as you know, something that you can enjoy rather than to go into
Mm,
profession.
yeah.
What's your plan, by the way? What you really want to do in your life? For you, suppose if I would say in next 5 years, where you will say to yourself, where Abdullah
Um,
wants to sit in future. What's in your mind? Like what you really want to do in your life as a
right
career?
now, right now it's a doctor. I want to become doctor,
You want to
but
become a medical doctor, right?
yes, but there is a chance I can go in the business too.
The business too. All
Yeah.
right. So that's, I mean, you can do, like, you can convert your medical field to the business. That's also a way to do that.
Mm,
Okay. So the last point here is like, resistant population increases. Antibiotics no longer work. So 4 points are there.
mm,
Antibiotics kill non-resistant bacteria. Resistant bacteria survive. Resistant bacteria reproduce. Resistant population increases. Getting?
okay.
The
No.
So antibiotics kill non-resistant bacteria. Resistant bacteria survive. Resistant bacteria, one if they survive, so definitely they have to go to reproduce. So resistant population increases. Our antibiotics no longer work. Getting?
Yes.
Great. Next. Previous. Okay, fine. I think it's completed now. Here,
Mm,
this question. It's a 4 mark question. Yeah, that's fine. We can. But remember, it should be in sequence. I told you already, like resistant. Antibiotics will kill the non-resistant. Resistant will survive. They will reproduce. They will produce resistant population, and antibiotics will not work. Will- Right? Getting?
Mm. Yes, yes.
Okay. Um, what we can do here is to have. Where was the question? Explain how this has occurred. I think this was the question. Last question is that we can attempt from AQA GCSC biology in worksheet as a hard question. I think not as much hard. Um. Okay, just a moment, please. I like this one. Here's a question for you. Look at this. Okay.
Mm.
So,
Okay.
so answer you need to write here is having 2 marks and one is of 3 marks. So 5 marks are overall. Yeah. Yes, in order to counteract this issue, an organization called Responsible Use of Medicine in Agriculture was set up in 1997. In 2019, Roma made the announcement that the sale of veterinary antibiotics for use in food producing animals was down 53% between 2014 and 2018. In 2014, 62.5 mg per kg veterinary antibiotics were sold for use in food producing animals. Calculate the mass of antibiotics that were sold in 2018. Give your answer
Mm.
in milligram per kg. It's a three
Okay.
mark question. And the
Okay.
second, in 2020, there was a large outbreak of avian influenza in the UK, which is sometimes referred to a bird flu. Explain why the overuse of antibiotics was not related to this recent outbreak. These are the two questions that you need to address here. Abdullah,
Yeah, okay, okay, okay.
just start writing the answer.
Okay, so in 2018,
Huh?
the in 2018 the mass will be 33.125.
Okay.
Okay, okay. And the next question in 2022 there was a
Mhm. How much reduction is there? About
what?
53?
No, no, no.
Uh, uh, I, I'm
30,
I'm asking like
33.125.
the overall. Like I'm talking about like reduction is in overall. Like is this like 53%?
Yes, yes. So
So 20
it
2018 level you would have um I would
no
say
from 2014 to 2018, it was down from like it was down 53%. So I have to calculate the 53% like of 62.5.
what's the remaining there? If you
Yeah, the remaining will be 33.125.
47
No,
just
no,
mhm.
33.125.
How? 33.125. It's of, I'm talking about as a 100%, like, what will be the situation? You need to calculate this. Why are you making confusion here?
No,
Suppose,
no.
uh,
So
s-
I have to calculate the mass.
okay, okay, calculate the mass of antibiotics that were sold in 2018.
Mm.
So how you do that? Mg per kg.
So what I did, so I wait. Let's wait.
Mm. Is this not something
Mass.
like you need to do? For instance, reduction is 53%. So 2018 level, it would be 47% of 2014. Like 2018, you have 53% reduction, right? I'm talking
Yes.
about. So if you want to check the level in 2018, so definitely it would be the 47% of 2014,
Yes. So it's gonna be
because 53 is,
um,
because just you need to do what?
so
53 47, and that's equal to
so it's gonna be the answer is gonna be 29.375.
29.375. How? Can you just help me to
So
to understand, I mean,
okay.
so that,
So I multiplied 62.5 by
yeah,
53.
by 53 or
Then
47?
actually it's 43. But
Sorry. Mm,
no. I multiplied 62.5 by
mm,
53,
mm,
then divided by 100,
mm.
and then I subtracted the answer with 62.5.
So what's the final
So
answer?
I let me.
What's the
The
final
final answer
answer
is
there?
29.375.
29.375. All right, great.
Okay.
Yeah, it's correct. So,
Hmm.
what's about the option D now? Explain why the overuse of antibiotics was not related to this recent outbreak. Yeah. Hmm. Explain why the overuse of antibiotics was not related to this recent outbreak.
Because I think okay. So I think because the mm, because the mass of the antibiotic decreased in 2018, so
Hmm?
that's why it was not the reason for the outbreak.
I'm talking about avian influenza is caused by a virus, not bacteria. So antibiotics act on bacteria only, not on virus. It's a viral disease.
Oh,
Are you getting?
okay.
Yeah.
I
So
didn't
that's
know about that.
because antibiotics can only be effective
Yes.
uh
Bacteria.
on bacteria, right? So they have no effect on
Mm.
the virus, right?
Yes.
Okay, still I think few questions, few
Mm.
two I mean 3, 4 or 5 questions from hard part that we can do. Otherwise, we can move to the next topic as well in now next class, right? So I'll give you three more questions from here to complete this, and then we'll go for the next part. Okay?
Okay.
What we should discuss tomorrow, that would be of non-communicable.
Wait, let me see.
Yeah?
Um, so yes, non-communicable and also like preventing disease, viral, fungal, and protist diseases, and like this.
Yeah, yes, exactly. This part is remaining here. Uh, like fungal diseases, right? That
Mm.
is from the
And
communicable
uh,
diseases.
and the day after we're gonna cover plant diseases and defenses.
Okay, yeah. Okay, all right, done. Okay, Abdullah, let's conclude this session for today. Take care of yourself. Bye bye. See you
Mm,
tomorrow.
okay.
Okay, Allah Hafiz.
Allah
Take
Hafiz.
care. Allah Hafiz.